Hello, I'm Steve Heward with the Florida Department of Health in Sarasota County. I'm here today with Chuck Henry, the Administrator for the Health and Human Services for Sarasota County, just to talk a little bit about the COVID vaccination process, appointments, and where we're going today. So Chuck, I understand that we received some more vaccine today. Would you like to tell us how much we got
Yes, we did,
today?
Steve. We received 1,400 additional doses this morning. We're processing those in and already setting up clinics to run on Wednesday and Thursday to distribute those 1,400 doses out to the community.
So Chuck, as the appointments come available on the Eventbrite system at 3:30 today, and people are making those appointments, how many appointments are actually available for the 150,000 people in Sarasota County that are 65 and above?
Well, that's a great question, Steve. The number of appointments available is limited by the number of doses of vaccine I have. So we're planning to do 700 doses on Wednesday and 700 doses on Thursday so that we can get that vaccine out to the community as rapidly as possible.
And can we talk about a little bit of why appointments are so important for this particular process?
Absolutely. So appointments become important not only to help individuals know when to be here, but they help us manage the vaccine process in a safe way. We don't want too many people queuing up in line, so we ask people not to show up more than 15 minutes before their appointment. And if they arrive here in their vehicle a little earlier, we ask them to wait in the vehicle and then come over to the building 15 minutes before their appointment. If they have an appointment, they'll get in and get their vaccines. We try to allow space for social distancing for those in line. And then we have vaccine sites set up at several locations around the building. And once you have your vaccine, there's a 15-minute wait period after the vaccine to make sure there's no allergic reactions before we release you. And so in order to have space to do that safely, both for those getting vaccines and for our staff, we limit it to 100 appointments per hour.
Chuck, thanks for talking about the social distancing and the appointment process as people are arriving to the building. You know, it's really important for people to understand that. So not only do we need to bring that mask and, the thought that we have to social distance, but we also need to bring our patients with us because we're serving such a large number of the community with such few vaccine resources. Can you just talk a little bit about the need for people to just be ready to wait a little bit and that we will be getting vaccines as time marches on?
Absolutely, and that's a great point. Vaccines are coming in to every county around the state and here in Sarasota as well, but the number of vaccines is still limited. We expect that to increase dramatically over the next few weeks, but until that happens, we're limited by the number of vaccines we receive in terms of what we can distribute out. And so we ask for people's patience, even once they have an appointment. They'll have to arrive, like I shared before, 15 minutes before your appointment, and then we'll move you through the system. It's pretty efficient once you get here. And as we get more vaccines in the system, we probably will be looking at some drive-through sites or some other locations to ensure that everybody has access, even if they have mobility issues.
So that brings up a really great point with mobility issues and just making an appointment in general. So for people who may not have internet, for example, or not have a computer or access to a computer, what are we doing in Sarasota County to help those folks as we move forward with this process?
Again, that's something that's a significant concern for us because we want every citizen to have access to appointments that's 65 and above. And right now, because there's such a high demand, not only in Sarasota, as we've seen with the online appointment system filling up quickly, in counties where they've tried to open phone lines, those phone lines get overwhelmed and crash almost immediately. So we're looking at what's happening around the states, what's successful, what's not successful, and we're working hard to put a system in place that will allow call-in or other appointment means so that everyone will have access to the appointments.
That's excellent. Thank you so much. So, we heard last week that we got 3,500 doses into the community, and then today we received another 1,400 doses of the vaccine. Could you just give the community an update as to where we'll be at with our allotment of vaccine by the time we end our clinic Thursday?
So today we scheduled 800 individuals, and at the end of the day today, unless we have some no-shows, which is probably not likely, we'll have about 170 doses left out of our initial allotment. We've received 1,400 new doses today. We're scheduling all of those for Wednesday and Thursday, and we still have some doses available for healthcare workers. I might get a couple hundred back from fire EMS as they wrap up what they have, and as soon as those are available to me, we'll be scheduling those out to the community as well into one of our 3 priority groups. And remember, that's the 65 and above group that we've been talking about, but it also includes all frontline healthcare workers as well as long-term care facilities. And some of the long-term care facilities will get vaccines through Walgreens and CVS through a federal contract, but not all of them. So we're looking at all that and trying to manage the vaccines we have. I can assure you that probably no later than Friday afternoon, we'll probably be completely out of vaccines until our next allotment arrives. I would anticipate that being early next week.
That's great. That's great information for the community, and that way everyone knows that as we receive more vaccine into the community, we'll plan and schedule more COVID vaccination clinics for the community, and we'll be able to get that information out through the website, through our Alert Sarasota system. And with that, I'll just remind everybody of a few little things. So today at 3:30, we'll be opening our next block of appointments in Eventbrite. Remember to get in there and refresh that browser before 3:30 and then again at 3:30. We have a limit of 700 vaccines for the Wednesday and Thursday clinics. They will fill up fast, so just please stay advised as to future clinic availabilities. And with that, thanks for joining us today.